today on Sunrise at Sea, a very interesting topic that I came across. Now, very many of you, I'm sure, have heard it, have read it on the internet, have been told about it. But did you know that the belching that you have, you know, that bad air that comes out when you have mixed foods or when you have eaten a certain kind of way, or the burn that you feel in your chest, as many people would call heartburn, is actually a symptom among the symptoms of an acid reflux? Did you know that? I am no expert, so I will not define, I will not dive into it. I will allow the good doctor to do what she does best. Good morning, doctor. Yes. And thank you so much for joining us this morning.
Good morning, Shivan. I'm Dr. Hildur Rim. I'm an ENT surgeon with the Yasmin Healthcare Specialist.
Absolutely. So first things first, I know you heard me give my preamble. I'm one of those people who actually thought things like heartburn and belching is just a condition on its own. I did not know that it's actually among the symptoms of an acid reflux. So my first thing would be, would you define what an acid reflux is?
So acid reflux disease is a condition where the content of your stomach, like the acid from your stomach, can come back into your chest, the throat, even your mouth after eating, a few hours after eating.
Okay.
So it's something normal when it happens just once in a while, but if it's frequently happening to you after meals or before meals, then you're having the condition.
Okay. So what causes it? What are the causes of this acid reflux?
So there are very many causes of acid reflux disease. The most important bit is your diet. If the feeding is not appropriate for your digestive system, then you will have this condition happening to you. That is sometimes summarized in what you're eating, when you're eating, how you're eating, and how fast you're eating. So
even how fast you're eating?
Yes, even how fast you're eating. If you eat too fast, then you're not actually chewing the food properly, and the digestion period will take longer time, where your stomach is pouring more acid juices to digest that food, and gives you higher chance of having those acids reaching up to your throat.
Interesting.
Yes.
It's a wonder, like, not only, first of all, you need to, that means even one needs to understand their digestive system, because several times I've had my mom say she doesn't want to eat beyond a certain period because her digestion takes long. So how are you even, first of all, able to know that you have a very high digestive system or a very low digestive system if you're going to avoid this acid reflux?
That is a very interesting question, actually. That's the key for your treatment.
Okay.
You should actually listen to your digestive system. If you're having belching, if you're having issues with your digestive system, then what you're eating is not right. You have to look back at your plate and see what you are eating. So there are certain foods that can cause this acid reflux.
Okay.
The chief of these foods are citrus fruits. If
like
you're
oranges.
taking oranges, lemon, passion fruits, pineapples, then you're having higher acid content going into your stomach. So if you have other issues that can happen to you, and we shall talk about them, the content that will come up will be very high in acidity, and your throat, your food pipe, and your mouth were not designed to receive
the kind of acidity.
So they cause irritation and burning sensation.
Doctor, I'm sorry to cut you short, but this is a very interesting conversation. I didn't think it would be this interesting. So in other words, citrus fruits, when you talk about the pineapple, when you talk about oranges, when you talk about lemon, when you talk about passion fruits, but again, these are some of the fruits that actually we are told help to cut down fats. We're actually told to eat them every day. For me, every morning, there's a pineapple on my plate, there's an orange on my plate, there's a passion fruit on my plate, and later in the evening, I'm having this issue and I'm wondering, but I've eaten fruits, it's a healthy meal. How come I'm having an acid reflux? Like, make it make sense.
Yes, so you cannot cut down fats by eating more acids. Instead, you should not eat much fats. So if you avoid eating that, you have exercises, then you will cut down the fats. Increasing acidity in your stomach only helps increasing acidity. It can't help digestion, it can't help actually cutting fats. It's a mistake, like most of the mistakes that make the acid reflux to happen are taking on empty stomach water with lemon juice. It's what
Can you
people do
imagine?
actually. And then for the last 2 years, we have seen a rise in the number of acid reflux disease cases, and that is because due to COVID, patients were thinking that they should take ginger and lemon with tea every morning. That is a deadly mixture. Most patients who have acid reflux know about it after they have taken for many months or years the same concoction. There are some patients who tell you, oh, I take lemon juice because it is to detoxify my body. No, don't take alcohol, don't take soda. Eat healthy and you will not have toxins in your body.
Are you all listening to what I'm listening to right now? Because every single thing that we have thought that is written by the book is actually not by the book. How many people in the morning, let's talk about the people that go to work. How many people in the morning make warm water and add in lemon and honey under the pretext of you're detoxifying, you're keeping healthy, yet in actual sense, you're adding more acid to your body. And then how many people will take oranges or will squeeze oranges and take them plain because they are trying to get rid of a flu or a cough? But also, a specialist would tell you that that is the best way when you're getting rid of flu or cough. You want to eat lots of fruits. Yes. So is it that you have to eat them in a certain measure, or are you supposed to eat them alongside something else?
So if you want to eat fruits, you have a very wide range of fruits. You shouldn't be putting yourself on the side of the acidic ones. You have other options: watermelon, pawpaw, apples, bananas, and avocados. These are fruits that are also healthy. They bring the vitamins needed to your body, but don't really raise much of your acidity. So as we are going to talk about treatment, one of the things we ask you to do is to replace those fruits you are taking by the ones that don't raise acid very much.
Is alcohol among the things that actually cause acid reflux?
Very much. Now, for alcohol is a dangerous substance in this case.
Okay.
You're having burning due to acid rising up, then your lining will try to repair itself by making a new one. And every time you take alcohol, the new lining can be destroyed by that alcohol, because alcohol destroys and scrapes off, removes actually your layer that produces the mucus in your throat.
Yes.
And then you're having another injury every time you eat because you've not changed your diet properly, and you're still going to have more acid affecting and burning your lining.
Okay, so what are some of the symptoms? How can you tell? And this one I ask not just because I want you to elaborate more on it, but I've had people say that sometimes acid reflux is a sign that you're actually getting ulcers. Are they connected in any way?
Yes, they are, and sometimes no.
They're not. Okay.
So the symptoms, the chief symptom is a burning feeling alongside like the upper part of your
abdomen,
stomach, the abdomen, the food pipe, your throat, and sometimes in the mouth. So you feel a burning sensation, sour taste in the mouth. Someone wakes up in the morning, they feel they have sour saliva. And also, sometimes they wake up with a lot of mucus in the throat. As they are brushing, they feel like they have to empty the throat from the mucus, which is excessive inside. There are some patients who tell you that I have a lot of saliva. That is because the swallowing is not happening the way it should be. So your saliva accumulates in the mouth, since there are other forces bringing what's in your stomach into your throat, so you can't swallow at the same time.
Okay.
Then other symptoms would be chest pain, having also sensitivity of the teeth, because the acid will destroy the enamel, that shiny layer that covers your teeth. So you drink cold or hot beverages and you feel pain in your teeth, like an electric shock.
Yes.
There are other symptoms also. There are some patients who would think they have a heart attack, because it will bring a similar chest pain like a heart attack. Some others will have stomach pain. And the relationship here is because one of the causes of increased acidity in the stomach is having a bacteria that causes ulcers, which is called Helicobacter pylori.
Yes.
So when it increases the acid levels, of course you're having reflux because maybe of your diet, and you're going to have excessive acidity. One of the other causes of this is eating fried food.
Yeah. That is a conversation in Uganda we don't want to have. We don't want to talk about it.
Yes, and because it starts from breakfast, where the diet starts with a fried escort, as they call it. They take tea with
Chindazi.
with something fried, chapati or samosa.
Yes.
But also you go to have lunch and you're having chips and fried chicken. So the whole combination of
It's
your
just fried
meals
food.
is fried food. So fats will float on top of your acid in the stomach because it's in a very big quantity, and the stomach will sense that it can't digest it, so it pours more acid. But instead, as we know, it's not in the stomach that we digest fats, it's in the first portion of the intestine with your bile salts. So since it's not happening, you're just going to have now reflux, things coming back, which are acidic and burning because they have oil in them. You can even sense what you ate.
Yes, you can.
Like a few hours before.
So finally, as we wrap up this conversation, let's look at the treatment plan. Let's look at something long-term for someone that has been experiencing this and they're thinking, okay, it comes and goes, so it's not really a big deal. How can they deal with it on a day-to-day?
So what the doctor will do is to examine you, and then he will carry out some tests. One of them is important to carry out in case the patient doesn't respond to the change of diet and treatment, which is endoscopy. The endoscopy is to introduce a camera device into your throat, which will go along your upper digestive system, the upper portion of your digestive system.
That alone is very scary.
We will have to do that in case you don't improve, because sometimes this condition can cause cancer in the food pipe. So you would think you still have acid reflux, and you say, it's just heartburn, I've had it for 5 years.
Yes.
But you're having now difficulty to swallow, you feel like food can't pass properly or fast. So that is very important to carry out. Sometimes too much acidity can cause you to have candida growing in your food pipe, and it will have the same symptoms, but it needs a different type of treatment.
So now candida is also in the throat?
Yes, the candida can be in anywhere from your mouth to the end of your digestive system. So when it is in your throat or in your food pipe, then it can cause the same symptoms, but it can be treated with specific treatment.
Okay.
And then lastly, one of the issues that cause this is when you do endoscopy, you might discover that what has caused you the heartburn all these years is to have a small portion of your stomach in your chest instead of all of it being in your stomach.
A small portion of your stomach
is stuck in your chest.
Okay.
You can be born with it, or it can happen in women after pregnancy, where her organs are all pushed up, and then some portion of the stomach can go there. You can jump as you do in sport, and then a small portion goes into there. Sometimes just because you are born with a very wide opening of your diaphragm muscle, the muscle that separates abdomen from chest.
Well, thank you so much for giving us such an insightful conversation. Do you have any last remarks that you would like to pass on?
Just listen to your digestive system. It will tell you what is appropriate and what is not.
Okay, so the next time we sit down with a good doctor, maybe she'll be letting us know on how best you can listen to your digestive system, because I don't want to find people telling, please listen to my stomach, listen, is my digestive system working? Anyway, that winds up what I had for you this morning. Keep watching Sunrise at Sea.